When you enter the building, the staff will come out and they will greet you. Coming to a PHP or IOP program, coming to a partial hospitalization or intensive outpatient treatment, it's a huge ask from people to come and devote that large amount of time to their own mental health. And I know sometimes we in our life can feel like that's a selfish move, but really it's the most selfless thing that we can do is really give ourselves the ability to be healthy.
Coming here for a first time, people are facing a lot of complex issues at a crisis in their life. The door should be open for them to feel welcome, supported, validated, and having an opportunity to experience support while they're facing those issues.
We have a multidisciplinary team that will be working with you. So we've got group room leaders, we've got behavioral specialists, therapeutic specialists, RNs. Our medical staff consists of psychologists, nurse practitioners, physician's assistants, and psychiatrists. So the involvement and the teamwork that comes in to individualize and collaborate with your family to provide the best care and outcomes, I think is what definitely sets us apart.
If you come into an OCD program, you're going to be doing exposure-based treatment, ERP, which is exposure and ritual prevention. In a program like depression recovery, you would still be doing something similar where you could be doing some exposures, but mostly you would be doing behavioral activation and working with dialectical behavioral therapy or CBT therapy.
Everything at the Brown Deer campus is within walking distance. We've got inpatient that's right across the street. We have a residential facility that's being built right now, which will also be right across the street and be attached to the hospital. And then we've got the partial hospitalization and intensive outpatient programs here. I think the clinic is unique because we have so many different programs that we're able to treat in one building. One half of the building is dedicated to child and adolescent, and the other half of the building is dedicated to adults. Based upon what your needs are at the moment, we're able to transition a patient to whatever level of care is most needed while still staying with the same providers, being able to coordinate through the treatment teams and have that continuation of care and make sure that there's no gaps of information. And then after you do discharge, we will work with the families and the patients to set up aftercare.
Rogers is a short-term experience. Our purpose is to teach you the skills that you need to get back to your life, and outpatient therapy is a part of that life. And our protocols and our programs work because we set you up with outpatient therapy. So we really get you to know yourself, to know your needs, to know what you need to grow, and then you take that to your outpatient therapist and you have a really good roadmap to get back into your life. Just to see the patients learn the things that maybe they've never learned before in their life and be able to apply it to themselves. Those are the small little details that make a big impact.